Now we're going to Facebook. We're on Facebook. Hey, ladies and gentlemen, I hope you can see Dr. Jerry Smith and myself, Dr. Ron. We're trying out and see if we can bring you the latest medical news and commentary, both on our Blog Talk radio show, which is on Tuesdays at 4 p.m., which can be heard on blogtalkradio.com or called in at 347-989-8899. But now we want to try and bring it to you live on Facebook and YouTube. So tonight, we'll after we log into Blog Talk Radio, we'll try and get everything coordinated. And tomorrow, if everything worked out good, we will be live again from 4 to 5:30. Bringing you the latest and greatest, and we'll be talking about leaky gut syndrome, leaky brain syndrome, which not a lot of people talk about, something about the small bowels, growth of bacteria, how that's important for your health. Because if you've listened to our other shows, you know that the majority of your immune system functions out of your gut. So we've had some great programs. I want Dr. Jerry to say something. I mean, we found out that the electromagnetic fields, if you have a phone up to your head, that opens up that blood-brain barrier, and you can have mercury going right to your brain. So while we're waiting for the 2 minutes to log on to Blog Talk Radio, here's Dr. Jerry Smith, co-host and lecturer, has all kinds of awards in natural treatment of diseases. I'll just let him tell you. Hey, Jerry.
Well, thank you, Dr. Ron. There's many solutions out there that are not ever going to be heard on the 11 o'clock news because they're too effective and don't involve drugs. A perfect example is oregano oil. 100% pure oregano oil works better than an antibiotic without any adverse side effects. I had a patient about a year and a half ago who had MRSA, that methicillin-resistant staphylococcal infection, and I was the 31st doctor. And the bottom line is, I put the patient on the oregano oil, and 6 weeks later, his MRSA totally disappeared. So stories like this happen routinely when you're using high-powered herbs or vitamins or minerals, and along with enzymes. They all work together synergistically to boost the immune system as opposed to suppressing it.
Good introduction. And ladies and gentlemen, we'll introduce it again when we're on Blog Talk Radio air. We have a very extremely important guest coming on October 16th, Dr. William Wong. And you heard Dr. Jerry Smith talk about systemic enzymes, not the enzymes we need to digest food, that's the lower end of why enzymes are needed, but the enzymes the systemic enzymes to they serve as catalysts to help our body's reactions and to be healthy. And we'll probably hit a little bit about that today as a preamble. But if you can hear that. We're going live on Blog Talk Radio. Well, ladies and gentlemen, this is Dr. Ron along with Dr. Jerry Smith. Welcoming you to Dr. Ron Unfiltered, Uncensored. Our normal time is Tuesday at 4, and we usually go as long as an hour and a half. But on every show, we always say, and we welcome you with an attitude of gratitude. You've heard that saying before, but having an attitude of gratitude, ladies and gentlemen, makes you happier and healthier. Did you know that? One reason is because a feeling of gratitude makes us see things more optimistically. So, ladies and gentlemen, I am Dr. Ron. Dr. Jerry Smith will join us shortly, but I have to keep some people happy by telling you that this program contains general medical information. The medical information heard on this program is not advice. It should not be treated as such. The information is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. You should never delay seeking medical advice, disregard medical advice, or discontinue medical treatment because of information heard on this program. You are encouraged to confirm any information obtained from this program with other sources and review all information regarding any medical condition or treatment with your physician. That being said, ladies and gentlemen, let me introduce, and I hope you can see, Dr. Jerry Smith, my co-host, and he could actually just take over this whole program if he needed to. So, Dr. Jerry Smith, why don't you tell our audience a little bit about yourself?
Well, I graduated dental school back in 1969, spent 2 years in the military as a general dentist. Then when I came out, I set up practice in Newtown, Pennsylvania. And in 1974, I got involved and did a 2-year orthodontic training program. So that was the 74 to 76. But the big turning point in my professional career occurred in 1982 when I was invited to speak at a chiropractic study group. And then they invited me to join. So it opened up a whole new horizon of information that I never knew existed. And then I started taking chiropractic courses, and for 2 years I studied hot and heavy on my own. And then when I had questions, I would ask the chiropractors at the study group once a month. Bottom line is, it took me on a journey of over 35 years to connect the dots on how the dental component and the chiropractic component, the cranium, the spine, the pelvis, the muscles, the ligaments, the organs, all work together synergistically. And it was really exciting to be a part of this pioneering work, because there's very few people in the world that have connected the dots and understand patients' problems when they're presented. So that's, in a nutshell, my Cliff Notes version.
And ladies and gentlemen, I graduated in 1965. So between the two of us, we have 100 and some years of experience behind us in the field of medicine. And we try and bring you information you will not typically receive on the mainstream media news outlets. And some of the information that you receive there, we try and counterbalance that with science rather than information controlled by the big pharmaceutical industry, because the big pharmaceutical industry is a bigger lobby even than energy at this point. So over the past couple of weeks, we've been talking about statin drugs. We've been talking about high fructose corn syrup and its relationship to liver disease and diabetes. We've been talking all about different kinds of drugs that can cause disease. So I'm going to just follow up with something that came through today, because, we're all being scammed. Everybody's trying to scam you. There's rip-off artists everywhere, right? You're getting phone calls saying they're from the IRS, and everybody wants to try and get your money. Here in Florida, after hurricanes, everybody's a contractor, and they want to get your money, and then they never show up. Well, we've been talking about statins for 5 years, and this can rob you not only of money, but something more valuable than your money, and that's your health and your vitality. So it's a con game, ladies and gentlemen, that goes on every single day, because physicians, and we talked about how the big pharmaceutical companies control the board of directors at medical schools. The young docs are dishing out statins to more and more seniors. According to the latest numbers, and Dr. Jerry has some great information on that last week, and if you care to, our shows are archived at Blog Talk Radio. They're also archived at iTunes, Google Play, Alexa, Blueberry, Stitcher, TuneIn Radio, and recently iHeartRadio has picked up our podcast. And so you can listen to the shows of the past. Actually, I think 276 of them, so we're really proud of that. So half of everyone in the United States over the age of 75 has received a prescription for one of these statin drugs. It's a cash cow for these people. That's the pharmaceutical people. But what do we really know about statins in seniors? Because none of the trials that we've been able to look at included folks in their golden years. Until now, that is. There's some late research that came out that's from several universities in Spain. They examined the health records of 46,000 people ages 74 and older. guess what they found? They found that the ones who popped these medications daily didn't have fewer cases of heart disease and didn't live longer, even comparing them to the ones who were not taking them. Even for the ones who already had heart problems, the statins did zilch, ladies and gentlemen, did nothing to improve their health or prolong their lives. So from my opinion, my humble opinion, these drugs are worthless. And I've told you this. And I told you that big pharmaceutical companies are making a fortune on these drugs. And the aging population of baby boomers is helping drug makers to rake in even more money. But, you know, the worst part of this heart hoax is that statins aren't just worthless. As we talked about last week and the week prior, they're all risk and no gain. You've heard no pain, no gain. Well, they're all risk and no gain. They are associated with memory loss, forgetfulness and confusion, cataracts, vision problems, limited mobility, muscle pain, weakness, diabetes, Parkinson's disease. And gosh, if you want a disease that'll steal your independence, ladies and gentlemen, it is diabetes. Quite clearly, statins can give you type 2 diabetes. So this just came out today, and something that your physician probably will never tell you, but we told you 3 years ago. Statins are known to cause hardening of the arteries. Is that ironic or not? And they interact with a boatload of other prescription drugs, blood thinners, antibiotics, hypertension drugs, acid-suppressing medications, like Nexium, which you shouldn't be taking anyway, because as you get older, you have less acid, not more acid. So the bottom line is that these drugs are bad news whenever you age. But we shouldn't be the doc should not be pressing seniors to take these drugs. It's a con game. And as we told you, high cholesterol numbers aren't really high at all, but an overblown risk factor to push more statins. Dr. Jerry Smith and myself have continually said that the basic cause of most of the chronic diseases, the basic cause is inflammation. And you can just control that by having more good fats like olive oil and coconut oil, ditching the bad fats, those hydrogenated oils, and get some exercise every day. So that's my opening monologue, and I'll turn it over to Dr. Jerry Smith.
Well, thank you, Dr. Ron. You're 100% correct with your assessment of the statins. The thing that's so disheartening, I was at a high school reunion several weeks ago, and one of my classmates was telling me about her poor husband, who's in one of these perpetual care facilities, and she was telling me that he has beginnings of dementia, and one time he got violent on her, and she had to call the police. And she felt so badly, but she was fearful of her life. But the long and short of it, when I was speaking to her, I said, "Is your husband by any chance on statin drugs?" She said, "Yeah, he's been taking it for years. Plus, every year he would get the flu shot." I said, "I bet my diploma that his dementia is coming from a combination of the statin drugs and probably the thimerosal, the mercury, ethyl mercury that gets up into the brain, and wreaking havoc with his mental capacity." And she really felt disheartened because here they're trying to do the right thing and go by the recommendation of their physician, and in the long run, it's actually what got them to be in the institution. So that kind of breaks my heart as a physician, that people are being led down the wrong path and paying a heavy price. So hopefully programs like ourselves that we do every week will enlighten the listeners so that they have more sense about questioning when a doctor recommends an invasive procedure or a medication that has 4 pages of adverse effects and 2 sentences that it may help you. You really have to take charge, as Dr. Ron would always say, take charge of your own health and question what the heck's going on, because it's your body. and you only have yourself to blame if you don't do your homework. And the bottom line is, if a plumber came in and you had 20 feet of clogged pipe and you only changed 4 feet of the 20 feet, you throw him the heck out and say, this guy's a real plumber. I mean, a shoemaker. But the key is it's no different in medicine. You think your heart surgeon is God when he replaces 3 or 4 little blood vessels around your heart, but the other 70,000 miles of blood vessels are being clogged in your body. It's no different. You have to look at globally what the heck's going on in your body, and not just the immediate symptom.
That's
my 2 cents worth.
That's worth more than 2 cents, ladies and gentlemen, because we try and look at the global picture. We have a saying that Dr. Smith started. You have to get the splinter out. You just can't put a Band-Aid and black salve on it. You have to get the splinter out. There's something you haven't heard in a while, Dr. Jerry. Black salve.
Yeah, it's magic grease.
But ladies and gentlemen, these are the topics that we talk about on Tuesdays. We talk about colloidal silver. Did your physician ever tell you to take colloidal silver for sinusitis before he put you on like a Cipro? I see more Cipro given out, and Cipro is a dangerous drug that can cause your main artery in your body to rip apart. It can cause an aneurysm. It has so many bad side effects. And then you take that, and then you get a C. diff infection, and along with all the other antibiotics you're exposed to. But we talk about colloidal silver. And we'll talk to like Phil Safer from Alexa Corporation, and learn different things, different tidbits from him. He's always on the cutting edge. We have great guests. I mean, we had Dr. Russell Jaffe and his predictive biomarkers. When you go to your physician, if you ask for these 8 tests, and based on the results, if you can improve those 8 tests, you can extend your life. We had Dr. Bennett Amalu. Dr. Amalu, as you know, is the doctor who discovered CTE in football players. Mike Weaver, to be specific, started his career. We have a tremendous guest. I think I can speak for Dr. Jerry. He has put together a lot of what I have learned also in my career as a family physician, as a holistic physician, as a certified emergency physician. I'm also board certified by the American Academy of Pain Management. I was a super specialist for the Social Security Administration. That all being said, even studying with Dr. Hans Nieper in Hanover, Germany, he just brought something together for me that we hope to bring to you October 16th in a show that will have a wide range of topics, but we'll talk about systemic enzymes. Okay, and probably you never heard about them. You probably heard about enzymes from pineapple and papaya. Dr. Jerry will tell you a little bit about the actions of systemic enzymes. It's incredible what they do. And he was also took care of the Olympic weightlifting team, and we'll explore with him his ideas and the science behind his ideas on aerobic training and anaerobic training like weightlifting. So Dr. Jerry, maybe in this short period we're going to be on, how about a few notes about what do systemic enzymes do for us?
Well, basically one of the main functions is to reduce inflammation. And as you said earlier, Ron, it's the common denominator of all diseases. I don't care if it's cancer or to a splinter in your hand. The inflammation impedes the blood supply to the tissue. It impedes the availability of the nutrients to the tissue. It impedes the exiting of the toxins from the tissue. And clinically, I've witnessed, and you may have had the same experience, that when you have areas of inflammation, viruses and other bugs migrate to these areas of trauma. So the advantage of the systemic enzyme is that it eats away any foreign protein that doesn't belong there, whether it be a virus, a bacteria, fibrin, excuse me. And it opens up that tissue for better and quicker healing. What's fascinating uh, the space program is doing reverse engineering, and they came up with A2M proteolytic enzyme, and it's so darn powerful that it's like a time-lapse photography. The healing mechanism is sped up so fast that it's amazing. All these doctors and they're trying to get it through the FDA. So there's a long history of systemic enzymes, at least 40 years, and about 200 articles in peer-reviewed PubMed. The key in the equation is that drugs hamper the healing process. They make you more acidic in most cases, whereas the enzymes dissolve away the fibrin that's clogging up the healing area, and plus your blood vessels. People don't realize it, that dementia, atherosclerosis, clogging of your arteries, cirrhosis of the liver, or any of these disease processes have an excess of fibrin being laid down in the parenchyma or tissue of that organ. And it's basically like pouring concrete into an organ. It becomes hard, solidified, and it can't function anymore. And this is what degenerative diseases are all about, and death. So if you can reverse that micro circulation in that organ, get rid of that fibrin, add flexibility to that organ and the tissues, you'll feel like 21 again. So that's the excitement of the systemic enzymes. They're better than I think pretty much anything out there as far as anti-aging is concerned. Healing mechanism is dramatically improved, and your sense of well-being. And the key is you want to go and have all your marbles in your pocket, not in a nursing home with a tube up every orifice. So I think our listeners will get on the bandwagon and start doing some research on the systemic enzyme, because it's going to extend their life and their quality of life, and avoid hospital stays and expensive surgical procedures in the long run. So I'm all excited about it, and I can't wait for Dr. Wong to come on. He has a wealth of knowledge, and hopefully you'll tell your friends and neighbors to listen in, or at least listen to the archive copy of our show, and you're going to walk away with information that you're never going to hear on the 11 o'clock news. So Dr. Ron, I don't know about you, but I'm excited to have him on the show and get some really good questions to him, and let it go where it goes.
I agree, and we were going to have him on 2 occasions, but he got called for jury duty, and the good citizen he is, and he's a Marine, he's going to jury duty, so we canceled our October 2nd date. So October 16th will be the first time we'll have him on, and I'm sure there'll be many. But I want to interest our female listeners out there, the anti-aging properties of the enzymes. Ladies, gets rid of wrinkles, and spider veins. Okay, think of that. It's antiviral. It has natural killer cells. It enhances that. It has a lot to do with estrogen and fibrosis, and I'm not going to go a lot into that right now because he'll cover that in detail. But like Dr. Jerry said, fibrosis of your organs is aging. As you get older, your organs get harder and harder and harder, and then they finally die out. Okay, so the systemic enzymes help them, and they can take the place of NSAIDs, the ibuprofens, etc., which kill 20,000 people a year. So we're very excited to have him on the program. We're on Facebook at Dr. Ron Unfiltered Uncensored. Our YouTube station is Dr. Ron Unfiltered Uncensored. Instagram, Dr. Ron Unfiltered Uncensored. That's Dr. Ron. If you could tell your friends, if they're not near a computer, they can call in at 347-989-8899, 347-989-8899. If they like what they hear and they want to suggest future topics for Dr. Jerry and I to discuss, let them drop me an email at docronradio@gmail.com, docronradio@gmail.com, and we'll be glad to get a program together on the topics that you're interested in.
Dr. Ron, is Dr. Wong going to be entertaining questions from our audience?
I'm sure he will, but he's in Texas, and I don't know his time frame. But he did say he could spend an hour and a half with us. So
Okay.
he has so much to say, ladies and gentlemen. In my mind, I don't know where it's going to go. I'm going to be prepared to challenge him on some issues, and he can speak for an hour and a half. I've heard him speak. So maybe we can, as a format for that show, limit his first appearance to an hour and take calls from 5 to 5:30. So that's a great suggestion.
Or maybe better yet, have our listening audience submit questions prior to the October 16th presentation, so we can have a whole list to ask them while we're interviewing.
So there's another jewel for you, ladies and gentlemen. Send me some questions for Dr. Juan and systemic enzymes at docronradio@gmail.com. And the day of his appearance, I'll also open up a chat room, and you can you'll see that if you join the show at blogtalkradio.com/health network. I'll open up a chat room, and you can get your questions in that way. So we're going to try and make this as easy as possible, and try and get to as many people as possible, because this information could be life-changing.
So, I can give you a little snippet of my own personal experience with the serrapeptase. Literally, about 2 months ago, I couldn't squeeze my fingers together to make a fist. And I think it was some trauma that I had. Either my cat scratched me on the hand, I didn't have any infections, but my hand was swollen stiff. And I've been taking the serrapeptase for about 2 months now. And in the last week, I upped the dosage to 3 capsules 3 times a day. And like about 3 days ago, I woke up and I was able to bend my fist. So, I'm a firm believer. I see it work on myself. I have patients with high blood pressure, 2 of them in particular, that nothing prescription-wise or vitamin-wise would affect their blood pressure. And after just 6 weeks on the serrapeptase, they both have normal blood pressure. I mean, that blew my circuits, and my patients are like ecstatic. And all it is basically dissolving out the fibrin that's clogging the micros capillary system in the body, so that the heart doesn't have to pump as hard to get the blood into the tissue. And when you start decreasing the heart's ability to pump to lower the blood pressure, or taking diuretics, you're diminishing the blood supply to the tissue. It's going to die faster. It's total Neanderthal mentality. It's just illogical what they're doing.
So that's what you're going to hear on this program, ladies and gentlemen, and we'll continue to bring it as long as we have interest. And we're not complaining about anything, but just to give you an idea, we probably prepare 10 hours for 1 hour of airtime. So try and bring you the latest news, not just what you find in Preventive Magazine, but from quality journals and some scientific articles. So with that, ladies and gentlemen, this is just an introduction. I hope our live streaming is working. This is the first time we're trying it, and we just said, well, let's just jump in and do a program. So this is what you got. You're going to get a little bantering. I can't tell you that it'll always be so serious, because Dr. Jerry is a card, and he loves a little bit of red wine now and then. So, and if this really works, I told Dr. Wong I will fly to his home in Texas, and we'll broadcast the show live from his place. So that's how important I think he is to keeping people healthy. And just to reveal, I am taking it. My wife is taking it. We do take this Zyme Essence. It's a really well-made product, and we'll talk more about that, of course, on October 16th. But where you had to take 30 and 40 capsules a day, this you take 2 or 3. That's how powerful it is. So, Dr. Jerry, I hope this worked. I hope the video came through on Facebook and on YouTube, and we'll know after we close it down.
Well, great. I can't wait to get the feedback on it.
All right. Thank you, ladies and gentlemen. Dr. Ron here, Dr. Jerry here. We'll be on tomorrow at 4 o'clock. We'll be discussing the leaky gut syndrome, the leaky brain syndrome. I bet you didn't hear a lot about that on the 11 o'clock news. So with that, ladies and gentlemen, we will see you tomorrow, and hopefully again on YouTube or Facebook. Ciao.
Ciao. Take care.